Welcome to the Life Sciences Professional Podcast. I'm happy to introduce our next guest, which is Nils Clausen, who has over 25 years experience in the healthcare industry. He's currently the General Manager of CMEPP, and prior to that, for his 25 years experience in healthcare, he was in sales and marketing. He has supply chain management experience and supplier relationship development. Before joining CMEPP, Nils was an Associate VP Supplier Sales for GX North America and global organization that was dedicated to lowering the costs and finding supply chain efficiency. He also was with Baxter Corporation and Source Medical. And I'm happy to introduce Nils. He has lots of information that he can share in terms of his experience both in Canada and the US. And please help me welcome him to our podcast. Thanks so much, Nils, for joining me on the Life Science Professional Podcast. And I'm sure you've got lots of information that you can share with everybody. We've known each other for a long time. I won't share how long, but it goes way back to the Baxter days, right? And lots has changed on both our sides professionally. But, if you don't mind, just give a brief introduction to our listeners in terms of your background. If you could tell us a bit about yourself.
Sure, happy to, Linda. And first of all, just want to thank you for the opportunity of being part of your podcast. Real privilege to be here. So a little background on myself. I have a Bachelor of Arts from Huron College University of Western Ontario with a focus on economics. I've got over 25 years of experience in healthcare. I've worked for various different manufacturers, distributors, supply chain IT solutions. That's been a big focus of my career, both in the US and Canada. And currently I'm managing an organization that's focused on medical equipment maintenance management solutions. So overall, I really have a liking. I think my career has been focused on developing relationships with people. And a lot of that is with customer stakeholders, of course, but also with employees. And really, I'm trying to create something unique that provides value to people in general. As far as what I like to do in my spare time, well, first of all, I'm married with two adult children, not living at home, thank goodness. Yeah, that's always an issue for some folks, so I'm very fortunate. Got great kids. I live in Caledon, Ontario. I really like the outdoors. I like taking my dog for long walks on the trails out here. And in the summer, I like spending a lot of time on the water. I spend a lot of time in Georgian Bay. It's one of the best freshwater cruising areas in the world. So very privileged to be living in this area of the country and really enjoy that.
Right. That's good. Yeah. Well, we work hard. So being able to have that leisure time and being on the water, there's nothing better than that. That's for sure. Right.
Very
I like
relaxing.
water too. I don't like being on a boat. I get a bit sick. So I like being on a boat that doesn't move too much. So
that definitely helps.
Yeah, you're fortunate that you could do that. I wish I could.
Yeah.
Anyway, let's talk about, the healthcare system. And you and I've had these conversations many times over the years, but especially most recently, and the tremendous change that's happening in the healthcare system. And, where do you think it's going? You have lots of exposure to what's happening there.
Yeah. So when you look at it, things more on a macro basis, you look at things globally, it certainly doesn't look pretty.
Okay, so go ahead.
Yeah. So
okay.
So on a global basis, it really doesn't look good when you look at the workforce that we have in healthcare. I had the privilege of attending and presenting at the Canadian Diagnostic Executive Conference a couple of months ago, and really shocking stats on what I've heard. On a global basis, by 2030, on a global basis, we'll need 80 million healthcare workers. And the reality is we only have 65 million. So that leaves a shortage of about 15 million healthcare workers. And they said that was pretty conservative. It's probably more like 18 million. So we got a real problem when we look at healthcare and people and resources to support our healthcare organizations. So, the focus is really on resources, retention of those resources in our industry, and trying to attract new people into the profession. It was quite shocking to hear right now there's more people leaving the healthcare environment than new people coming in. And a lot of that is due to the tremendous change, as you mentioned, Linda, over the past couple of years with COVID. There's been a lot of burnout with people. At this conference, we kind of heard from various different senior leaders of each province, and it was a common theme that there's a lot of burnout with people, and it's hard to keep people in their organization. So, the other element that I thought was very interesting is we need to really focus on new innovative service delivery mechanisms. So move away from the traditional going to the hospital. Are there other ways of actually providing service delivery outside of the hospital environment? And that was a big focus. So in order to address the resource issue moving forward, the cost financial constraints that we have, we really need to focus on new innovative ways of providing service delivery.
And so, it is interesting because, we hear a lot about, the constant people leaving the industry, even the, the silent, there's the great resignation, there's the silent resignation, there's supply issues, there's all of those things. It's like this storm that's hitting us from all directions, and like, what do we do about that, right? Yeah. What were some of the, at the conference that you were hearing, what were some of the things that were innovative, maybe that are happening in the US that you heard maybe we don't have here, that you think are great solutions that are starting to pivot or to migrate over, that you think are solutions that are coming here?
Yeah, it was. That's a great question. It was really interesting to hear some of the feedback. We did also receive feedback from some key folks that know what's happening in the U.S. market. So the U.S. Challenges are very much the same as the Canadian challenges, but a little different nuance. In Canada, I think the biggest issue that came clear was there's different requirements versus urban versus rural resources. So in Canada, we're more geographically dispersed. So we have more of that issue than the United States. But in the United States, they have a different healthcare system, and it's a little less risk averse, I might say, in how they go about things. So they're really doing some very exciting things as far as innovative service delivery. And it's really what they're focusing on is moving it away from the traditional hospital setting into more of a retail setting. So I heard stories about the investments organizations like Walmart is doing, and other big retail pharmacy organizations in the US, where they're really building infrastructure down there to help provide service delivery of healthcare services into the retail sector versus the traditional hospital sector. They're doing things right now. They're really investing a lot of money to do that, and it was very exciting to hear. So hopefully some of that will translate into Canada as well, but they seem to be a few steps further as far as that innovation is concerned.
So that's like the lab tests that they're doing, and having clinics inside their pharmacies, and even having drive-through lab testing too, right? And and also rapid testing, like all kinds of rapid testing. It's not just like the COVID rapid testing that everybody thinks about, right? There's other type of testing that is they get the results faster.
What was really interesting is, with COVID, we learned about a lot of the issues, and you're right, they were doing drive-through COVID testing. I think we were doing that in Canada and a few places as well, just to meet the demand. But now they're looking at what about doing lab tests as a drive-through?
Yeah.
So when you give blood, why do you have to go to a clinic or a hospital to give blood? Why can't you just do it through a drive-through setting that's controlled and properly managed?
Yeah.
And some states are actually doing that.
Yeah.
And that's a great example, innovative way of just making it more convenient for people to get the service delivery, rather than, always having to go to their traditional hospital or doctor office.
And when you were at the conferences, they talk about, I mean, it doesn't matter if it's a healthcare setting or it's a business. Everybody's talking about the challenges around human capital, right? About having staffing and being really concerned about what are we going to do. Like there's help signs everywhere, whether it's retail banking, healthcare centers, but obviously when it comes to healthcare, that's a crisis, especially, you see what's happening with the respiratory illnesses with the children and not having the capacity to care for them and having to fly them, 4 hours or 6 hours away, that type of thing. That's frightening. What were some of the solutions they talked about around finding people or having technology to be able to help alleviate some of the staffing issues? Was there anything that you liked there?
There was a lot of talk. I mean, again, it was all focused on we need to change the way we're doing things, and we need to come up with new innovative ways of figuring that out. And also, the resource issue that we have in Canada in healthcare was a big concern. That seemed to be the common theme, and it's really about retaining people and attracting people to the industry. And what's interesting was by 2025, millennials will actually represent 75% of the workforce.
Yeah, I saw that. Yeah.
And that is compelling in the fact that it's a different mindset when you talk about millennials compared to the traditional baby boomers and the offset of the baby boomers. So it's important to recognize, the differences there. So there's different incentives required for that generation of people than what traditionally we've been set up in the past. So that was important, and that was something that they talked a lot about. And the millennials in general, they're more about work-life balance. Like, what is the work-life balance in the profession that I'm going to be focused in? And sometimes that's more important than compensation. So because at times I think in healthcare, people have been throwing financial incentives to attract people to the industry, and it's just not working. It's not resonating with that generation. So that's important to recognize, and we got to figure out different ways of incentivizing people based on that.
Well, it's interesting because, there's been a couple of hospitals recently that are saying, $5,000, $10,000 bonus if you come and join us, especially in the rural areas, like hard to recruit areas. And to your point, it's not working for them. And the reason it's not working is, nurses, because I get nurses or lab technicians, different professions, reaching out to me to say, can I get a sales job or customer service or something to go into, medical device companies or to lab companies, something else, utilize my experience I have into another area of healthcare. And when I talk to them, the reason they're asking is they're not getting any support in their organizations for the work-life balance like you're talking about. And all they're looking for is different shift choices or some support around not working during holidays or getting some educational training, or it's the culture, it's the support from the leadership. It's just a different mindset. And I think we're slow to adopt that, right? And, I remember being a nurse and, we didn't have a choice, right? You got the shifts that nobody else wanted when you were a new grad, but it was always, the same shifts. There were no changes. You couldn't work part-time. You couldn't work just weekends if you wanted. And so none of that flexibility. So some people would like to just work nights because it works better for their families. Some people just want to work days. Some just want to work weekends, whatever it is. And I think it's that really looking at being able to accommodate somehow, even though it might be a nightmare for scheduling some, but for whoever does the scheduling, it might be a way to retain people, right? Just as you do in other organizations, you have to find a way to accommodate people to get them to come work for you and figure out a way. You might have to employ more people, but you might have to have just different ways to attract and retain people, right? And some people want to retire, half retire, right? They don't want to totally retire. They want to retire in a different way. The challenge is if they're union organizations, it's not so easy, right? So there's challenges around there. Yeah. One of the things that I've seen over the years with you is you have a unique ability to attract great talent and build great teams. And the last couple of organizations that you've had, have been more unique startups. You've started two very unique organizations, right? The first one really dealing with the supply chain, and now where you're currently employed, or where you currently are general manager, they're both unique services that you've provided and really changed the model of how you present a solution to healthcare, which has been fantastic. But being able to attract individuals to your organization and retain them, you have a unique ability to do that. What do you attribute that to?
Yeah, it's interesting. I think it's important to note that any person really needs to feel a sense of purpose. And if you're able to achieve that with your team, it's important that you also associate recognition of their efforts. At all times, I've always made sure that we link our mission, vision, and values to our initiatives, to the work that people are doing on a regular basis, so they can see the linkage. First of all, just being a healthcare organization has its benefits. A lot of people really like being associated with a healthcare organization because I think everyone's had an experience with a loved one or a family member where they've gone through a bit of a challenge on the health side. So a lot of people, healthcare is a feel-good industry to be working in. That's a big positive in itself. But almost every interview I've had with people is really about culture. That's the common question. Every question I get is, so what is the culture like?
Yeah.
And it's a great question, and it's a hard one to actually answer. I mean, you can describe it, but people don't actually know it until they actually experience it. And a lot of it, that question, I think, is really around culture, but also what is the work-life balance? That is what is most important to people today. And what I find that works really well is being as transparent as you possibly can in your organization. Share information so people all are aligned, they all know what's going on, and really provide flexibility. And a common way is just a hybrid work environment. I definitely feel the days of working 9 to 5 at the office are gone. Traditionally, that's the way I always felt that was important, but I don't think it is anymore. And the past 3 years, I know my team, we've been working remotely, and our organization has just been growing phenomenally, 15-20% per year, and we've done that all remotely. And I think that is a great achievement, because a lot of times a lot of leaders feel that if you don't have the team working in the office, work isn't getting done. And I think on our experience, that's certainly not the case. Mm-hmm. The other thing is, I think just looking at how you position things. As an example, everybody knows what KPIs are, key performance indicators. Obviously, it's operational activities, and you measure performance related to that. That's the traditional way of thinking of it. Another way that a leader should look at it, instead of calling KPIs key performance indicators, they should change it to keep people interested, keep people informed,
yeah,
keep people involved, and keep people inspired. So that's a new way of kind of looking at something traditional and transforming that into something that's going to resonate with your team. And I find if you take that approach, it really has positive results.
And you know what, that is probably one of the best things I've heard in a long time, because we've come out of COVID, organizations are trying to find their new norm. They're trying to keep people inspired, like you said, and they're trying to figure out, do we go hybrid? Do we let them keep continuing to work remotely? Like, what do we do? And I think and of course you have to do what's ever best for the business, but at the same time, you have to look at, can it still work remotely? Like, why do they have to go back to the office? Like, what is the reasons for the decisions you're making? And does it make sense? And will it really impact your business more if you bring them into the office? Like, those things need to really be considered. But more importantly, to your point, in terms of when you're setting up KPIs. Like I was talking to one of my clients that's in the process of doing that this week with their team, and they're setting up 7 or 8 traditional KPIs. And I was asking, why that number instead of 4 or 5? You've got 7 or 8. It's really hard for people to stay focused on that, and they get bored and disenchanted, and they don't feel connected to them. It's for sure how they feel, right? So there's part of that, but also to Nils, your team and your culture, a lot of that has to do with as well how they feel the leaders treat them and being respected, right? In terms of their role that they play in the organization and how you and the rest of the leaders in the team treat them. That's part of the culture too, right? It's that atmosphere, like trusting them to work at home, right? Not always, calling them every day, what are you doing? Trusting that they're doing the work and, coaching them through any challenges they're having remotely, like you figured out how to coach remotely. Do you have any advice on that in terms of what you learned from the beginning and what you've learned now that you've done differently, sort of the trials and tribulations to make it work a little more effectively? Is there anything you can share?
Yeah, I think obviously you need to maintain the normal activities of the business and the measurement of the performance. So, key performance indicators, you still need those operational indicators. And I totally agree, Linda, that you shouldn't have too many. They should be really focused on the key drivers of your organization. But the other thing is, I think it's important for leaders of any organization to make sure that they have a presence and they're connected to all their people. We're basically a smaller organization of 15, 16 people. So it's much easier to do that with a smaller organization than it is with a larger one. But I really think having that connection with people and remotely, that makes it a little more challenging. It makes it easier because you can just get on, a webcast of some sort and connect with people live that way. But I think it's also important that they know that they can actually meet with someone physically as well. You don't want to lose that physical presence. So what we do in our organization, every once a week, we make sure the senior management team is in the office 1 day a week, the same day. So if anybody wants to come in and talk to their manager live or, just have that connection, we make that possible for them. And I think that's a positive way. So you're really giving your employees flexibility, you're giving them choice, but at the same time, you're allowing them to have that connection in that real live presence if they want to. And so far, since we've been doing that for the past 6 months or so, and it's worked out extremely well. And employees really like it because, they're not forced to come into the office and they can get that real life connection if they want to.
It's actually a great suggestion because I know that candidates I sometimes talk to say they don't feel that connection with their manager because of being remote. And, we are human beings. We like that connection to each other, right? Whether it be doing this type of thing where you like webcasts, like you're saying, or being in person where you're talking to somebody. It depends on your personality and what it is that you need and making sure that happens. In your current organization, you help members address some of the strain on resources. And can you, in the healthcare system, they face due to COVID and the current challenges, but economic conditions, product, service administration, people. And, I think you've brought on more members because of that. They've seen the benefits or heard about it. And even when you've approached them, you've gone into some new areas within the healthcare system as well, like labs as an example. Can you speak to that in terms of, that added strain and how, sort of what you see sort of in the future and how you're doing that?
Sure. So, it's obvious today that there are resource issues and constraints in the healthcare industry. So it is here today, and it'll definitely be there tomorrow. So, I personally feel that resource management, resource issues is here to stay for the future. And we need to recognize that, and we need to help hospitals and healthcare organizations with that challenge. I think they need to rely on other organizations that can help them in different creative ways. When you look at it in healthcare, it's all about patients, patient safety, patient quality, patient experience, patient care. That's what hospital people really is their prime focus. But at the same time, they have to be fiscally responsible with their funds and managing that. And they have to use their time smartly. So the real challenge that they're faced with now is how can I actually save money? Because we all know the financial burdens in healthcare have been around for a while, and they continue to be province by province across the country. How can I save money at the same time not impacting my resources? So keeping my retention of resources, and how can others help me in that regard? And that's really what we've done is we've got a unique business model that really focuses on hard dollar savings. So money we're giving physically back to hospitals that they can repurpose, reinvest, buy new equipment, hire more nurses, staff, whatever they want. In addition, now we really focus on how else can we help you on the administrative side. So if your focus is around patient care and patient experience, how can we take the administrative burden off your people? Because that's the stuff that really takes a lot of time. Mm-hmm. And that's the stuff that sometimes gets missed. And it's not because people are not sensitive to that. It's just they don't have the time. And their time is more focused on the patient, and that's where it should be. So I really think organizations that can reach out and be creative in helping hospitals on the administrative side and managing what their day-to-day activities, whether it's contract management, equipment, what have you, that's what's going to be a big difference. And that's what we're focused on as an organization. And it seems to be resonating. We have, a lot of folks saying, listen, I need help. Like, can you help me? And I'm even willing to pay for it. Mm-hmm. Now, we're a not-for-profit organization, so that's not what our motive is. But we're here to actually help them. We want to be an added resource that they can tap into at any time that will just alleviate the burden off their organization.
Yeah, it's interesting because like when you're working with customers enough, like the healthcare institutions, and you're dealing with, the CEOs, CFOs, and users, once you're helping them and they see the resource that you are, they come to you and say, well, can you do this or can you do that, right? And you may not be able to help them in certain areas. Is there anything else that comes up or that you hear on a frequent basis that you think, geez, I wish we could do that, but that's not our wheelhouse? What seems to be, besides people, what seems to be really crying out loud?
Well, I think, again, just the financial burden that hospitals have, how can they uncover savings that they haven't looked at before? So obviously in procurement and hospitals, they have great teams that negotiate pricing, always trying to get a better price for the goods and products that they're trying to procure. But, there's only so much you can get out of that. And you look at the supplier community, they're merging, they're consolidating. Mm-hmm. So there's fewer suppliers out there, less competition. So the opportunity to shave off more on pricing is getting less and less. So that's a challenge because you're not going to get a lot of savings there. So how else can they actually get hard dollar savings? And that's where they need to, and they are, many organizations in Canada are looking at, how can I uncover something that I haven't looked at before? What's a new creative way of doing something that we're doing today, working with a partner organization that's going to help us so that it takes the workload away from us as well as drive savings for us in the future.
Yeah, that's, in the next 5-10 years, that's going to be their biggest struggle, right? Because their biggest cost is people, right? That's for sure. Yep. So there's that, and it's their cost of maintaining their facility and increasing also their capability, their technology to be able to treat patients in a more effective way, right? And then shift patients that aren't acute into the right facilities for the proper care, instead of taking up the acute beds. That's always been a challenge, or it has been actually for the last 10-20 years. They've been in the wrong facilities. So that's for sure that hopefully that's going to change. And, you know, anything else that you want to share in terms of what's next for you and your organization? Anything different for this 2023?
Yeah, I really think, obviously we've talked a lot about the resource constraints. So we're going to continue down that path and, expand the growth of our team appropriately to accommodate that for those healthcare organizations that need that kind of focus. Not everyone's at that stage of course, but some certainly are. The other is information and data. So I think that's key. A lot of companies are focused on that now, and as we are as well. So, we've been around for over 25 years as an organization, and we've got 25 years of data that is just sitting there that we need to harvest and translate that into valuable information that we can give back to healthcare stakeholders so they can make better decisions, specifically around what they're doing. In our business, it's all around medical equipment. So that's really what our focus is really creating a platform that allows access to this information so that hospitals can make better decisions and understand what their costs are. A lot of challenges I think they have medical equipment. Some of it is very, very expensive when you look at CT scanners, MRIs, that sort of thing. And, when do they replace it? When do they decommission it? And that is a big question. And it's not an easy one because it really depends on usage as well. We look at COVID, there was a huge focus on labs. So lab equipment was used quite a bit for the testing for COVID. And a lot of procedures on the diagnostic side were put on hold because of the focus that had to be done on the lab side. So you had a lot of diagnostic equipment not really fully being utilized for the past few years the way it traditionally has. So a lot of hospitals saying, so do I really need to replace it after 7 years, which is what the manufacturer's telling me, or can I get another couple of years out of it? So that's where I think the power of data, the power of information, and I know we have it in our system. We just need to harvest it and put it in a proper format so that they can see how it performs and compare it to aggregated data for similar equipment across the country. That's really what we're focused on.
And that's actually phenomenal information, because if they're not able to extrapolate that data currently themselves or do a comparative to sort of industry standards, you're right. They're making decisions based on, recommendations. It's just like anything else. You don't necessarily, just because it's this certain time frame, that doesn't necessarily mean that's when you need to do it, unless of course it's going to help you save money on the other side, right? Treat patients quicker, be able to diagnose more effectively. Like there's got to be other benefits to it, right? To spend that money. So yeah, I think that's great. One last question, Nils, in terms of books or courses or for leaders in the industry as well, or individuals who want to become leaders, they're advancing in their career within the industry. What do you recommend, or associations that they could belong to keep themselves current? You've been always very good at doing that and making sure that you're very knowledgeable, but others, we all get caught up in the business we're in and don't necessarily, get involved like that. Any that you would highly recommend that people maybe focus on?
Yeah, no, there are many, many books out there on leadership, on various different authors. So some great books out there, and there's not one that really stands out more to me than others as far as that is concerned. But I will mention one area that I think has great value is it's an organization called ICD, which is the Institute of Corporate Directors. It's a not-for-profit organization, and it really focuses on leadership, education, awareness, trends for leaders of organizations, as well as board of directors in organizations. So if you're a part of an organization that reports into a board of directors, this resource is tremendous. We've been focused on it for the past year. They have great education courses that are focused around leadership within organizations for board members, chairing boards, running committees, running agendas, all that sort of thing. I have found it extremely valuable. And what we've done as an organization is we share that information. So whether it's me taking a leadership course, I'll take that course and then I'll share that with our board. Likewise, if a board member actually takes a course, they'll actually share their experience with the rest of the board as well as myself and my leadership team. And again, it's all about transparency and it's all about sharing of information. And I have found that the most valuable association for our organization and for myself personally.
Wow, that's great. Yeah, it's, sometimes we aren't aware of certain associations or organizations that we could really learn a great deal. And just the fact that everybody's sharing, because you can't all, it doesn't make sense to everyone to attend the same thing, right? So that's, and plus it's more cost effective that way. It makes sense, right?
Yeah, exactly.
Yeah, that's great. Well, I really appreciate your time and sharing information, and I'm sure that our listeners will as well. And enjoyed our time. Thank you.
As did I, Linda. Thank you very much for this opportunity. Really enjoyed, as always, talking about these type of issues, and I certainly look forward to tackling those challenges ahead of us.
Yeah, absolutely.